healthy choices, helping you live healthier. Sponsored by Intermountain Health.
It is that time of the year to protect yourself and your family.
It comes up quickly, doesn't it? Here to tell us what we need to know about cold and flu season from Intermountain Health in this sponsored interview is Dr. Tamara Sheffield and Julie Nelson. She's our nurse that's going to be standing right there behind because we're going to be getting our flu shots live on the air. Doctor, welcome back to the show.
Thank you so much. It's so good to be here with you.
Why is this important to talk about this time of year?
You know, we are just starting up with our respiratory virus season, and that means we've got influenza or the flu, respiratory syncytial virus, and COVID, all three that are going to be hitting us as we get gathered together and start passing our germs around every winter. This is when it's a cold and flu season. It's time to make sure we're vaccinated because people end up in the hospital, and we do have tens of thousands of deaths from influenza every year in our country.
It's so much more important, too, to remember the seniors and our young kids, the most susceptible to get vaccinated. But it's the #1 protection to prevent the sickness from spreading.
It is, and it helps us protect actually those who are most vulnerable, too, not just ourselves. So everybody who is 6 months and older needs to have an influenza vaccine. And we ought to go ahead and start getting you your vaccines as well.
We're getting it on the air, just like 3 years ago, COVID shots live on the air. We're doing it for flu season.
And it's just as important because we still respiratory viruses can land you in the hospital. And we just want to make sure that vaccines are the best way to protect, but we have lots of other ways too. We want to make sure that if you're feeling sick, don't go to school, don't take it to work. If you are, make sure you're always washing your hands frequently, covering your cough. Those Kleenex you use, don't have other people touch them, don't put them on surfaces, make sure they end up in the wastebasket. All these infection control practices, but the wonderful thing is the vaccine gives you that protection inside your body so that when the virus comes, it just can't infect you.
You know, I skipped my flu shot last year, and I got sick more than I had in previous years, and I really think that was why. What would you say to somebody who's still hesitant to get the vaccine?
You know, it's I understand why people have their concerns, but what I really want to make sure they understand is you're weighing out your risks, and the risk of passing this to someone who might be immunocompromised, who can't fight that infection, and actually in yourself as well. It's keeping you from having a week away from work, away from those things that are so important in your life, from those family gatherings.
Let's debunk some of the flu myths out there. And by the way, I can't believe Saray just had that done.
I know, badge of honor.
I didn't even notice while we were talking.
I know, the Band-Aid. I love the ones that you chose.
Because you're tough, because you're brave. That's why it's a superhero on your Band-Aid. Can you get the flu from the flu shot?
No, the vaccine has either a live inactivated for the ones that go in your nose, but all the other ones are just give you the proteins to help your body develop those antibodies it needs to protect itself. But there's nothing in it that can actually infect you or give you that infection.
I think sometimes people think, well, if I get the vaccine, then I won't get sick at all. That's not true, but it will be less.
Yes. So most individuals, it does protect you from getting sick. But if you do get the flu, there are sometimes a strain that is a little bit different. You know how we have variants of COVID? We have different strains of influenza. And so those different strains can infect you. But having those antibodies will help you actually fight it off more quickly, and you'll recover more quickly.
Nish, you just did it.
By the way, thank you so much for saying good job. She's whispering in my ear, good job.
You smiled through that. You were, well,
I know.
You forget to relax your arm, like you tense up, and why is that not a good idea?
Well, actually, it's going into the muscle, and you want to allow the fluid from the vaccine to actually just spread through the muscle. And so if you're tensed up, it stays in a little hard ball. You're going to actually want to move your arm around and keep that moving and just get the vaccine serum into the muscle.
Dr. Sheffield, it's recommended to get your flu shot before the end of October.
It is, but you can get it anytime through the influenza season. So the key time that we tend to have the most cases is January and February. So, but a lot of our family gatherings are when we start spreading it. So that's why we say end of October, November, best time frame before you're all getting together and could be passing it around.
Have you heard anything about this upcoming season?
We always look to the southern hemisphere, and it's it's a regular, active influenza season, and it's the same viruses that we're giving you the protection against today.
So we think that this vaccine is pretty accurate.
We
Pretty
do.
Good. All right.
And again, you
okay.
said 6 months and older. Is there any age limit on the upper end?
No, actually, there's no, but when you become 65, there are adjuvanted and higher dose flu vaccines that actually give you a more potent response. That's what you want as you get older.
All right, if you need more information, everybody, Intermountain Health has it for you. Dina, I know you're supposed to talk right now, but I'll do it for you because you're in the middle of getting a flu shot. IntermountainHealthcare.org is the website for more info on that flu vaccine. And again, thank you to Intermountain Health for this sponsored interview. What do you think?
Look, that was nothing. I didn't even
No
feel
thing.
bad. All right, still ahead.